There are a solid 7 or 8 really, really well understood risk factors. Many of these are modifiable, but some are not. So take them in any order you like, Tom.
Yeah, and the one thing we've been trying to exemplify later is the difference between risk factors and risk modifiers, risk markers. Risk factors have pretty much been shown to be causal of the disease through the ways you do that, Mendelian trials, a ton of randomized trials, and even observational trials, whereas the risk markers are not causal per se. Not to say they're not important and we should attempt to modify them all. So there is that little bit of distinction. So let's start off with the risk factors, things that are no doubt about it. Let's not argue about these. And age is one. Now, we can't modify that, so fine and dandy. But the things we can, smoking, of course, is really at the top of the list. And that can be modified with the patient's cooperation. Lipid disorders are certainly in the causal risk factors, and high blood pressure. You can say things like diabetes and everything, but, they bring basically the hypertension and the lipid disorders to the table. So the risk markers would be a long list of other things, and there are ones that are biomarkers, but others are not, like coronary calcium, CTA. If you see that you have atherosclerosis, that is certainly a risk marker. But homocysteine, omega-3 issues, vitamin D, a lot of the bioinflammatory markers that we can look at that would be, if you have risk factors and you have these risk markers on top of them, the worse gets worse. It's like a Chinese menu. The more things on there, it's going to be more expensive at the end of the day. So, of course, my world is lipidology. That's what I focus on. But I know in your practice, you're super aggressive with blood pressure management. It doesn't seem like there's too many smokers in your practice, which is good. Maybe they don't want Peter as their doctor if they're puffing away. So you can take it from there with that little introduction.